Okay, this is video number 2. We're going to talk about circulation and the pacemaker. So we talked already in the past about the circulation around the heart, which included the pulmonary circulation, the systemic circulation, and we'll talk about the coronary circulation in this video. So let's review the pulmonary circulation. So this is the right atrium. This is the left atrium, this is the right ventricle, and this is the left ventricle, which are the 4 chambers of the heart. So the pulmonary circulation begins at the right atrium. Remember the superior vena cava, inferior vena cava, and coronary sinus empty it into the right atrium. This blood's going to go through the tricuspid valve, and then it's going to go into the right ventricle. Then the ventricle is going to contract and it's going to push this deoxygenated blood out the pulmonary semilunar valves to the lungs. The vessel bringing this deoxygenated blood to the lungs is called the pulmonary artery. And on the models, this vessel is going to look blue because it's carrying deoxygenated blood. In the lungs, along the capillaries, which is where all the gas exchange occurs, we're going to release CO2 and we're going to take in oxygen. So now our blood is well oxygenated and it's going to return to the left atrium via the pulmonary vein. So the pulmonary vein on our model is going to appear red because it's carrying oxygenated blood. This blood's going to go into the left atrium and then pass through the bicuspid valve. Remember, another name was mitral, and a third name was the left atrioventricular valve. From the ventricle, it's going to pass through the aortic semilunar valve, and then it's going to go into the systemic circulation. So that's going to take this oxygenated blood all over the rest of the body. So let's talk about the systemic circulation. So this is the ascending aorta, right? So this blood is coming from the left ventricle via the aortic semilunar valve. So the first 2 vessels that come off this ascending aorta is the right and the left coronary arteries going into the coronary circulation, which is a separate little circulation that exists around the heart. So this is the ascending aorta, and this is the arch of the aorta. So this is where our mnemonic starts. So arch of the aorta, then we have brachiocephalic trunk or artery. We have the left common carotid and the left subclavian. So brachiocephalic means going to the head, cephalic, and the arm, the brachium. The left common carotid, the common carotid artery is going into our head and neck region, and the left subclavian means underneath the clavicle on the left side. Off of the brachiocephalic trunk, we have the right subclavian and the right common carotid, but on the right side, so it's the same to the same regions, but on the opposite side, but it's asymmetrical. On the right side, we have the brachiocephalic artery, and on the left side, we do not. So let's talk about the systemic circulation. Remember, we've talked about in the past how this is the thoracic cavity, and this is the abdominal pelvic cavity. So when the thoracic, the ascending aorta, arch of the aorta, when it starts to descend, we call this the thoracic cavity. when it crosses the diaphragm, which is the respiratory muscle that separates the thoracic cavity from the abdominal pelvic cavity, then this aorta in the abdominal cavity is called an abdominal aorta. Then it'll go further into the lower limbs, and we'll talk about that in the near future. So let's talk about the pulmonary circulation. We've talked about already how the blood, it's deoxygenated blood coming from this left ventricle, pulmonary semilunar valve, and the vessel that's carrying this deoxygenated blood from the pulmonary trunk to the pulmonary arteries, because they're carrying deoxygenated blood away from the heart. This blood is going into the lungs, and then it's going to come back oxygenated via the pulmonary veins into the left atrium. So I like this this image from our textbooks, but I would like you to draw this out. So let's go through this. I would like you to be able to draw this by heart and also recite what we're going to do right now. So we're going to start in the right atrium, okay? So deoxygenated blood is coming to the right atrium via the superior vena cava, inferior vena cava, and the coronary sinus. This deoxygenated blood is going to go through the tricuspid valve, also known as the left atrioventricular valve. Then it's going to go into the right ventricle and then out the pulmonary semilunar valve into the pulmonary trunk. And then the deoxygenated blood is going to divide into a right and left pulmonary arteries. And that's going to take this deoxygenated blood to the lungs. So in the lungs, in the pulmonary capillaries, we're going to expel CO2 and gain oxygen. Then this vessel bringing this oxygenated blood to the lungs is called the pulmonary veins. And that's going to go into the left atrium, out the bicuspid valve, or mitral or left atrioventricular valve. Then it's going to go into the left ventricle, out the aortic semilunar valve, into the ascending aorta, right? So take it a little further. So the first two vessels off the ascending aorta is going to be the right and left coronary arteries, arch of the aorta, and then we've got our brachiocephalic trunk, left common carotid, and left subclavian, right? And off of that brachiocephalic, we're going to have the right common carotid and the right subclavian. So let's talk about the coronary circulation, which is a separate little circulatory system around the heart. So there's two coronary arteries that exit off of the ascending aorta. We have the left coronary artery and the right coronary artery. So off of the left coronary artery, we have two arteries. One is called the anterior interventricular branch. So remember in the past we talked about how there's an anterior interventricular sulcus. This anterior interventricular branch is going to sit in that sulcus in the anterior part of the heart, and it's bringing oxygenated blood to the walls of both ventricles in the front of the heart. Off of the left coronary artery, we have the circumflex artery, and this is going to the left and bringing oxygenated blood to the walls of the left atrium. Off of the right coronary artery, it's going to the right side of the heart. It's going to immediately branch off into an artery called the right marginal branch, which is supplying the walls oxygen to the right ventricles. And then this artery is going to go follow through to the posterior part of the heart and go to that posterior interventricular sulcus, and we call that artery the posterior interventricular branch. I'll show you images of what this looks like. A term we have to know is the term anastomosis. So it provides an alternative route through collateral circulation. What that means, so if there's, for example, a part of the myocardial tissue, and for example, this coronary artery is possibly blocked due to arterial sclerosis or blockage, there are other arteries that can supply the same area to keep the heart healthy. So just like we have the coronary arteries, we have coronary veins. So coronary veins, they are taking away the deoxygenated blood in the heart, and they're dumping it through these smaller cardiac veins into the coronary sinus. So remember, the coronary sinus is in the posterior part of the heart, and it's going to bring deoxygenated blood into the right atrium. Remember that? So several veins are dumping into this larger vein, the coronary sinus. The first one is the great cardiac vein. And the interesting fact about that is that it's running with the anterior interventricular branch. There's one in the back of the heart called the middle cardiac vein, and that runs with the posterior interventricular branch. The way I remember this is, for example, the great cardiac vein, like the king, likes to sit in the front, and the middle cardiac vein sits in the back. That's the only way I can think of that in cartoon imagery. So let's look at what this looks like. So here's the left coronary artery, remember, off of the ascending aorta. I'll draw it here. It's going to go in the front of the heart, and that's called the anterior interventricular branch. And then there's another branch called the circumflex branch traveling around the heart, okay, on the left. The right coronary artery, we have it right here, coming off of the ascending aorta, is going to travel to the right. Then it's going to get to the side of the heart, and it's going to become the right marginal branch, supplying the right ventricle wall. And this is going to continually go to the posterior part of the heart, and it's going to go to the back of the heart. And we call this one the posterior interventricular branch. So there's a large vein that travels around the back of the heart, and that's this one. That's that coronary sinus. So what a sinus means is a large vein, and this coronary sinus is bringing all that deoxygenated blood that it's collected from all of these smaller veins and dumping it into the right atrium. So what are the smaller veins we have to know? Here's the great cardiac vein, and again, that travels in the front with the anterior interventricular branch. And in the back here, let me draw you, is the middle cardiac vein, and this is traveling with that posterior interventricular branch. Here's another image, and the reason I pulled this one up, because you could see the anterior part of the heart and the posterior view of the heart. We know where the anterior, because you could see the ascending aorta and the pulmonary trunk. So knowing that's anterior, then we know this artery that's traveling in that anterior interventricular sulcus is the anterior interventricular branch. The circumflex branch travels to the left off of the right coronary artery. We could see the marginal branch on the side of the heart, and then this is going to go to the back of the heart in the posterior interventricular artery. Here is an image, a posterior view of the heart. So how do we know we're looking at the posterior image of the heart, especially on a model? So we're going to notice here's the superior vena cava and the inferior vena cava. The other thing, you're going to see the pulmonary veins here. Okay, there's two from the right and two from the left. And the other big away is going to be this large coronary sinus in the back of the heart, like a big blue vessel. So in this posterior image here, we could see that posterior interventricular branch coming off of the right coronary artery. The vein, same thing. We could see the great cardiac vein in the front of the heart, middle cardiac vein in the back of the heart. We could see the atrium here with the pulmonary atrium, and these are the pulmonary arteries coming into the left atrium. We could see the superior and inferior vena cava, and also this large coronary sinus that travels in the back of the heart. And we could see the middle cardiac vein in the back. So let's look at the conduction system. So we talked about in the past how the heart has autorhythmicity, which that means that the initiation of the heartbeat is within the heart itself, and that's called the sinoatrial node, or that's also known as the natural pacemaker of the heart. So the excitation begins at the SA node, and it's going to go through a series of intercalated discs, and we'll follow this in order. So it starts at the SA node, and then it's going to travel to the AV node, or the atrioventricular node. And this is located in that interatrial septum between the right and left atrium. Then this impulse is going to travel to the AV bundles of His, which is actually located in a septum that travels in between the right and left ventricle. Then as it reaches the end or the apex of the heart, it's going to travel up the ventricles and eventually into the Purkinje fibers, which will initiate the ventricles to contract at the same time. So let's look at these in a little more detail. So initially, the excitation of the heart is going to begin at the SA node here along the interatrial septum, which is, located right here, okay? Then the next step, this impulse is going to go to the atrioventricular node, which is located right here between the atrium. The SA node is actually located near the superior vena cava, and then it's going to go to the interatrial septum. Then this impulse, and during this period, what is going to happen is there's going to be a slight delay in the signal, and this is the period of time after the SA node initiates. Both atria are going to contract at the same time. When these contract, it's going to push the blood in those chambers into the ventricles. So the delay in signal allows both ventricles to fill to a greater extent. Then this impulse is going to travel into the bundles of His, the AV bundles of His, and this is along this interventricular septum. Then it's going to get to the apex of the heart, and this is where it's going to divide into the right-left bundle branches along the cardiac muscle tissue, and then eventually from the apex, it's going to stimulate Purkinje fibers, which will initiate the contraction of both right and left ventricles, pushing that blood out of the pulmonary semilunar valve and the aortic semilunar valve. So it's important to note that the nervous system and hormones can alter the pace of contractions, but the initiation of the contraction is in the SA node. An EKG is called an electrocardiogram, and this is a recording of the heart's electrical activity. So this kind of reviews a little more in detail how the SA node is the natural pacemaker of the heart. It's going to stimulate both atria to contract at the same time. Then this impulse is going to travel to the atrioventricular node that's located in that interatrial septum. This is going to delay the signal as both atria contract. The delay allows the ventricles to fill to a greater extent. Then this impulse is going to travel down the interventricular septum. It's going to, at the apex of the heart, it's going to divide into right and left bundle branches. And then along the Purkinje fibers. And this is what's going to cause both ventricles to contract at the same time, pushing it through both semilunar valves. So how do we measure this activity? We measure this with an EKG. It's a recording of the electrical changes that accompany the heartbeat. So this is a brief overview of how we study this. So this initial wave is called the P wave. And what does that correlate with? It's the depolarization from the SA node to the two atria. Then this QRS, let me go this one. This QRS here indicates the wave of depolarization as both ventricles contract. The T wave indicates ventricular repolarization. So any kind of irregularity in this EKG can indicate an abnormal rhythm or a defect in this conduction system, and further testing is needed. So often, if the sinoatrial, the natural pacemaker of the heart, is affected or is not functioning or is damaged, we can put an artificial pacemaker in, and that's what it looks like on I would imagine on a cadaver. So the cardiac cycle. When we talk about the cardiac cycle, it includes this period of a relaxation period when all chambers are relaxed and the ventricles start to passively fill with blood. And it's atrial systole. When you think of systole, it's the contraction. The atria are contracting to completely fill the ventricles. And then ventricle systole is ventricular contraction, is where the ventricles contract, pushing this blood systemically or into the pulmonary circulation. So it's this continuous cardiac cycle of relaxation, atrial systole, and ventricular systole. So the atria contract while the ventricles relax, and then the ventricles contract while the two atrials contract. So when we think of systole, it means contraction, and the diastole is the relaxation. So heart sounds. So we listen to heart sounds through a stethoscope. It's called auscultation. So we're listening to these heart sounds. The first sound we hear, we call it S1 or lub. This is the blood turbulence caused by the closing of the AV valves. The second sound we hear is called dub. This is usually the turbulence caused by the closing of the semilunar valves. So when we're listening to these sounds, this is an image of where we could hear these. So the AV valve, even though it's located right in this region, we tend to listen to it in between the second and third costal cartilage region. The tricuspid valve is located a little medial to the fifth intercostal region, but we listen to this a little more on the left along the sixth costal region. The pulmonary valve is located in between the the third costal junction, but we listen to that below the second rib at the costochondral junction. And the biceps valve, even though it's located in this region, we tend to hear it um, just below the fifth rib on the left. Okay, we will continue soon with the vessels.